Hello everyone, myself Dr. Malika, DNB Family Medicine resident. Today I am going to say about the pneumothorax. We got very interesting case in the emergency, so I thought of sharing this with you. Pneumothorax is nothing but the accumulation of air in the pleural cavity. It is of three types: spontaneous pneumothorax, traumatic pneumothorax, and tension pneumothorax. Spontaneous pneumothorax is caused by some underlying lung diseases like emphysema, cystic fibrosis, pneumonia, like this condition. The patient will be having some bleps. Bleps is nothing but the accumulated air cavity which will get ruptured and may lead to the pneumothorax. The second type is a traumatic pneumothorax. This is caused by either blunt trauma or the penetrating trauma. Penetrating trauma includes the gunshot injuries, vagera, and blunt trauma like the rod injuries, etc. It may lead to the traumatic pneumothorax. Coming to the tension pneumothorax, this is a very serious condition the patient will be having. This is called, in this condition, there is no exit of the air entry, which lead to the increased intrathoracic pressure, and this may lead to the shift of the mediastinum to the opposite side of the lung, which further lead to the compression of the inferior vena cava, and there may be the compression of the heart, which may lead to the decrease in the cardiac output. In this condition, the patient needs a very immediate intervention. We have to decompress the chest. Just have a look over this slide. Please focus on this. This is a pneumothorax is nothing but the accumulation of air in the pleural cavity. The patient will be having the symptoms like dyspnea, uneven chest expansion, chest pain, and decreased tactile parameters, hyperresonant on the affected side, and the diminished breath sound all over the affected side. And this is a type of the pneumothorax. If you want this slide, just comment in the comment section so that I will share this slide with you. Just have a look over the X-ray of the chest. This is a chest X-ray showing the massive pneumothorax. You can see this on the right side. This is only the right part of the right lung which is not collapsed, and there is a shift of the mediastinum towards the left side. The patient came to the emergency with the severe chest pain and having the severe breathlessness. And we were checking the past history. There is no recent past history and there is no traumatic history. Then we immediately advised the chest X-ray. Then we got to find this pneumothorax. Then we immediately shifted to the CT chest. Now I'll show the CT chest, which is very beautiful. In this X-ray, you can see this is this is a pneumothorax, which is very massive and almost completely collapsing the right lung. This is only the right lung which is not collapsed, and you can see that mediastinum is almost shifted to the left side. And you can, if you see this CT chest carefully, you can also see the consolidation, which I will show. See, can you see the consolidation on the left side? Yeah, this is the pneumonia patch. The patient is also having the pneumonia patch with the massive pneumothorax on the left side. Sorry, on the right side. That's it. Hmm. So as the patient is having the massive pneumothorax, so we just called the surgeon. The surgeon came immediately and inserted the intercostal drain. Where you have to know the place of the intercostal drainage. It should be always inserted on the fifth intercostal space on the mid axillary line. After inserting this, we kept on IV antibiotics. The patient, right now the patient is in ICU on under observation. Thank you. And I want to say few causes of the pneumonia, because all MBBS student and family medicine student will get this question in the theory. What are the causes of pneumothorax? Just we'll do the brush up. The causes of pneumothorax are the some previous underlying causes like emphysema, um, cystic fibrosis. If the patient is having pneumonia, pneumocystic girovica, if the patient is having HIV, the patient will be having high chances of getting pneumothorax. And even in TB cases, we can see this in Marfan's syndrome. And coming to the trauma, blunt trauma and the penetrating trauma. Coming to the connective tissue disorders like the rheumatoid arthritis, SLE, and lung cancer, even in this condition, we can see the pneumothorax. The tension pneumothorax is a very emergency condition. You have to take the action very immediately, or else the patient may lead into the very serious condition. Hope this will be helpful. Thank you.